Welcome to the video portion of the Functional Training Specialist program. In this video, we're going to talk about assessments first, then the dynamic or active warm-ups, and then exercise progressions or beginning exercise progressions. Make sure above all else you're taking into account individual needs and limitations and not basing your program upon what has worked for others in the past, but what works for the individual. Before performing any functional exercise or designing an exercise program, time must be taken to perform a functional assessment. Now, in determining a person's particular anatomical capabilities and limitations, you need to understand not only the difference between anatomical neutral and anatomical position, but their anatomical neutral and their anatomical position. In this case, Shannon, who is also a trainer, I'm helping her examine or take a look at her own particular neutral position, making sure her feet are roughly parallel and about shoulder width apart. Make sure that chin stays tucked in so her head is level, shoulders are level, and arms are bilaterally symmetrical. And you want to make sure you look at the person from the front, from the side, and the back. This would basically be the static postural assessment. Few trainers take the time to actually go through this process. You're just getting a feel for how the person stands and how they carry their body, so you have an idea of what you're looking at before you try to fit them into a program, how to make sure the program fits them. So you're going to need to take the time, maybe a minute, maybe 2 minutes. That may be all it's going to take to get a general idea of how they stand, both from the anterior or the front, laterally from the side, and posterior from the back. And you're going to see a lot of dramatic differences from each side and each position. In this case, Shannon has a tremendous collapsed arch on that left side, very much pronates, tends to put a lot of pressure down on the inside medial arch of that foot, and so she tends to rotate not only on that foot, but also affects her hip as well. Now I'm going to hand her a roller here, because with that roller she's going to hold it above her head and perform a squat. We're going to watch her arms, her spine, which actually always comes first, and her legs as well. We're going to basically start with the spine, examining that, and watching the joints that are moving. She's going to try and keep her arms above her head as much as possible. You can see that her knees tend to kind of cave in a little bit, and both of her arches of her feet are both caving in a little bit. Watching her feet to see if they actually can stay symmetrical. Watching the knees to see if they line up with the second and third toes. Watching any lateral rotation, and watching to see if the arm carries forward. If she leans forward too much, chances are she has very tight hip flexors, which she does. If her elbows bend, can be a great indicator of pectoralis major tightness, or if she leans forward too much with her arms, which she does a little bit, latissimus dorsi tightness. But she does get a bit of an excessive lean forward, tight hip flexors. Lumbar spine, she seems to be okay, but she definitely has a pretty good anterior pelvic tilt, which is going to affect her gluteus maximus and medius development and activation. Dorsiflexion is not too bad. She's getting decent depth. We'd like her really to be able to get almost to the floor. We're not loading her up, so it's okay to get as low as possible with this. If you start adding load to a squat, you want to be careful about how far down you actually descend. But again, you want to probably have her do, or your client do, at least 3 to 5, maybe more, squats from each angle. You may have to do more because you want to have them just do it as long as it takes to get a strong idea what they're capable of and how they're moving. And then you're going to have her just your client stand on one leg, and you notice right away she's having a little difficulty just standing on that one leg. She tends to lean or kick her hip out. That tends to be gluteus medius weakness. The hip tends to kick out and end up using her spine for more lateral flexion type movements, or hip abductions are hard to accomplish, so the back takes over, and this side's even worse, where her arch seems to cave a little bit and she really kicks that right hip out quite a bit. But you're also just getting them to think about their own balance, be aware of their position in space. From that, we'll take it into a push-up. In the push-up position, you need to make sure the forearms are parallel to each other, and the wrists and elbows are roughly in line with the nipple line in the chest. But most importantly, once again, you're focusing on the spine first. making sure she keeps a roughly neutral spine in this case. That protracted head of hers is something that's a concern for us. I want to take note of. That head pulling forward, some weak cervical flexors and some overactive extensors. You want to make sure you draw the abdominal muscles in tight. You want to count those reps as many as you can perform, 2 seconds down, 2 seconds up, with good form. And from that, or you may even want to do the plank before the push-ups. But the plank, or the prone bridge, is a crucial exercise or assessment for determining core stability, or in this case, her ability to be able to draw the transverse abdominis in to support the lumbo-pelvic hip complex. In this case, she was dropping the hips down just a little bit. She's actually doing a pretty good job. But that greater trochanter of that hip must line up with the glenohumeral joint of the shoulder. You want to try and keep relatively still as long as they can hold it. But you want to cue them the entire time so they're aware of their own position. You always want to be careful about moving people. You don't move them, but you want to make them aware of their own position, as I'm trying to explain to her just a little bit as well. The next assessment is going to be the lunge. Here I'm kind of showing her what I want her to do. Some people don't have any idea how a lunge should be performed other than what they've watched other people do. You want to drop straight down. You don't want to cue her, but you're looking for her to be the ability to be able to drop straight down. She does relatively well. She kind of tends to get that lean forward. The hips move forward because of tight hip flexors. She's straight up and down, which also is probably more of a learned pattern. The problem with being straight up and down is it puts a great deal of stress at the knee. Should look fairly much like a squat. If she drops down controlled, she'll lean slightly forward. On the other side, you would see a lot more differentiation from one side to the other, as you'll see here in just a moment. But you also want to look for asymmetry or differences from one side to the other. That can play a big role in determining what you're going to do as far as designing an exercise program. In this case, her width apart from her legs is pretty good. She actually has a greater stability problem because of that right hip, that weak gluteus medius there. Her hip kicks out a little bit more on this side. She has a little more difficulty with stability there. Shoulders are level, head's level, hips pretty level, but it's more of a differentiation from one side to the next. It really comes a lot from her hips, is where most of her instability problems are. You're not always going to be able to tell everything from a few lunges or a few squats, but you're going to get a good idea where to start. You want to really watch those feet, watch for that caved arch in that front leg, which she's really getting on that left foot. Now you can really watch that knee come in quite a bit, because the caving arch, or the medial arch of that foot, the weak anterior tibialis, tight calf muscles, and it's also getting some internal rotation to the hip as well. It's always hard to tell if it's coming more from the hip or the ankle, or just both. A lot of those knee problems can come from instability at both of those joints. I'm watching her do quite a few because she's just having some minor problems, or so it seems, but they can play such a significant role. You want to be sure about what you're seeing. If you have to have them do a lot of lunges, that just may be what you have to do. You want to tell them initially that you're going to look at 3 to 5 lunges from each angle, but once again, if you have a hard time determining exactly what's going on and you want to look at them a little bit more, then do. Don't be shy when asking that. After performing the effective functional assessments to get a clear idea of what the client's capable of, then it's time to perform the warm-ups. And this basic exercise is a crucial one to make sure the client can actively recruit the transverse abdominis, which just simply means laying on the back, lying down supine, and drawing abdominal muscles in and just tightening. If they can't do that, it's going to be a lot harder to do much of anything else because the transverse abdominis is not going to be active first. And that's going to cause a lot of dysfunction. Then we're having her do a few ankle rotations, ankle circumduction. Also, you can do ankle bets, drawing large capital letters of the alphabet with the foot, taking care to actually support that knee so she doesn't have extraneous movement at the hip or the knee. It needs to come just from the ankle to help strengthen up the tibialis muscles and to loosen up those calf muscles and actually loosen up all the connective tissue around the ankle joint that gets so overly active when it shouldn't be because we are so used to performing the same movements the same way, or in the case of most people, it's very little movement at all. From there, we're going to have her do a a torso or a hip crossover. Have her just simply roll from one side to the other, drawing the abs in tight. Once again, that has to start first because you want to make sure they have that concept down until it becomes natural, if it isn't already. And just rolling nice and easily from side to side, not flopping, good tempo, good control. She's also slightly dorsiflexing to get her tibialis muscles, her anterior tibialis muscle, active while she's performing this movement. It's a real easy, smooth back and forth. And the lower end version is keeping the feet on the ground. If they're fairly accomplished at it, keep good form as far as keeping the abs drawn in tight, they can actually bring the feet off the ground as well. And then more for torso mobility, particularly horizontal AD and abduction. Still going to have that side lying position where she rolls over and actually going to have one hand going out and away, keeping the knees and the feet together, trying to rotate more from the spine and getting movement in the scapula and the glenohumeral joint for the shoulder. Her head will rotate with her arm as well. She returns all the way back onto her side again and rotates out. Does not move the knees. Hips will rotate just a little bit. It's almost impossible not to let them move at all, but very little. And get another look from her from the other side. Make sure the head and the shoulder come all the way over, or you're just not going to get the same benefit from this exercise. Like all these exercises, there's always different ways of performing them. If you have a particular variation that you like, as long as your client's capable of performing it and you're clear about your expectations, their physiological capabilities, and whether or not the joint movement and the muscular capabilities are there, then feel free to add that in. From that, they're just going to take her back into neutral again, just to relax just for a moment. And perform Ys and Ts. It's a great therapeutic exercise for getting the scapula and the humerus, or the scapulohumeral rhythm, to be working effectively, so the scapular muscles can adduct and depress properly, as well as she's getting a little bit of shoulder flexion and abduction as well, and also some external rotation at the shoulder. All those things are the exact opposite of what most people do. They're sitting in their chair all day long, they're talking on the phone, they're driving in their car with that rounded forward shoulder, protracted head, and the internally rotated shoulder as well. So they're doing the exact opposite motion. T's as well to kind of activate the rhomboids and the posterior deltoids a little bit more. It's very important to go straight up. And all these warm-up exercises should be starting with a very light, easy, controlled tempo. And she's going plenty slow. She actually might be able to go even slightly quicker than she is. But it's better to be on the safe side with controlled and slower than trying to move so fast. The muscles you're intending to activate are not going to be the muscles that are actually providing most of the movement. And all these movements for the warm-up are going to be performed more in the higher range. Could be as little as 10, as many as 25 or 30, all depending on the movement and the goal. She's kind of loosening up her shoulders a little bit because she's got such tight trapezius muscles and neck musculature with that protracted head. She had to kind of loosen up a little bit before she continued. Now the Cobra exercise is also a great exercise for the same concepts of getting the external rotation of the shoulder, scapular depression, scapular adduction, as well as making sure she gets appropriate spinal extension while keeping that cervical spine actually tucked in this case. In yoga classes and in some training situations, a lot of clients will either bring their head up, or the trainer will tell them to go ahead and let your cervical spine go into a little more extension, but we want to, generally speaking, reinforce that tucked chin, or to reinforce the concept we don't want the protracted forward head. So if they have that problem, make sure the head stays tucked down. And she's taking that into a Superman maneuver with the arms extended out straight in front of her. And she's not bringing her legs off the ground. A lot of people will bring their legs off the ground. The problem with that is you end up getting a lot of excessive hip extension and a lot of compensation with the lumbar spine. it's actually extending too much rather than it coming from the hips. So we tend to kind of try to avoid that early on and focus just on the shoulder flexion, those last few degrees of motion, and a little bit of spinal extension as well from the thoracic and the cervical regions more so than the lumbar region. Then they can progress further from there. And this is a very important activation exercise because typically speaking, most people lack gluteus medius activation capabilities. So they have great instability at the hip. When they rotate, the hip kicks out. Standing in one place, the hip will often kick to one side more than the other. When they rotate, one hip will rotate forward more than it should. During gait, when people are walking, you'll see a lot of rotation side to side with the hips. One leg stick out, almost like they have to bring the leg up rather than going out and forward. A lot of times, many of those problems can be greatly reduced by having a very active and healthy gluteus medius muscle. So all we're really doing is some light hip abduction, just making sure her upper leg is actually slightly in front, the knee is slightly in front of the lower knee, and her hip is slightly in front of the lower hip, and it's probably no more than 15 to 30 degrees, maximum maybe 45 degrees of abduction. With hip adduction, again, very small, short range of motion. Otherwise, she's going to get compensation, in this case, more from the lateral flexors of her spine. Some people will tend to raise up their spine and actually rotate up, and the head will come off the ground, and you'll see that upper shoulder start to come up a little bit because they're using their spine to get this movement if they go too fast, or if they lack the capability to activate or isolate only the adductors of the hip, bringing it up and in. She's actually dorsiflexing a little bit again, trying to reinforce the anterior tibialis activation that she lacks a little bit of, and most of your clients are going to lack a great deal of. Once again, we return to the drawing in maneuver from a quadruped stance. It's a good beginning to actually take the time to do this before doing any quadruped activities, just to remind the muscles again what they're supposed to be doing. It seems so obvious and it seems so simple. Time just isn't taken to do it. So what happens is we get movement from the shoulder or the hip or the knee. The transverse abdominis doesn't activate first. That does create greater problems as far as mobility goes, and more probabilities for a low back injury or other injuries because of an inability to support or stabilize at the core musculature of the lumbopelvic hip complex. And she's going to take that into an anterior posterior pelvic tilt. Because her hip flexors are so tight, she has a hard time getting a great range here. Moving into an anterior pelvic tilt here, trying to arch that low back. She's actually getting some extension from the lumbar spine and getting some hip flexion involved with it. So the pelvis tends to look like it goes backward. It's actually tilting forward. And then a posterior pelvic tilt, which she lacks quite a bit of, again, because of how tight that whole area is for her. Be able to tuck the hips underneath, and getting a little bit rectus abdominis activation, as well as the hamstrings and perhaps even gluteus maximus will be involved a little bit as well. But she has such tight musculature in that whole hip region, she has a very difficult time performing this. And then you can take it into spinal flexion, where you're actually getting flexion from the spine as well as a posterior pelvic tilt. And then spinal extension, and that's when it's okay to kind of bring that head up. Not that it isn't okay to bring it up at any time, but again, you need to reinforce whatever those movement impairments are, to reinforce proper movement, contrary to the movement impairments a lot of your clients will have. With her forward head, we're trying to really reinforce her tucking that chin down rather than extending up too much as she flexes the spine and anteriorly tilts the pelvis. But taking it through a nice, easy range of motion, each rotation of the pelvis should get a little bit easier and easier to loosen up a little bit more and more. We're going to take that into a very easy hip extension and knee extension. If this exercise is done properly, there won't be any shifting of the hips, which she's getting. Some of that may be due to the knees being too close together. So the knees should be at least right about hip width apart. Any wider is probably too wide, with the hands directly below the shoulders. And you'll be able to see how much shift they get while they're trying to perform this exercise. But if she takes the time to perform those previous warm-ups right before it, does them well, this really shouldn't be a problem. But it really should be more gluteus maximus activation than anything else as long as the transverse abdominis can activate like it should. It's a very controlled motion, continually activating the core musculature to keep the pelvis stable while she extends at the hip and the knee. And coming to the exercise that Shannon greatly needs, and most of your clients are going to need as well, is the protraction, retraction of the cervical spine. In protraction, the top two cervical articulations, the C1 and C2, are actually flexing, while C3 through C7 are actually extending. So you've got a kind of combination between what's happening at C1-2 being different from C3 to C7. Just an important differentiation to be able to differentiate the difference between complete cervical flexion and extension, but a very good exercise to reinforce the chin tucking in by utilizing the both end ranges of motion with extreme protraction and extreme retraction. And ideally, after time, they're going to be able to find that neutral spot with the ears right level with the shoulders, chin level with the shoulders, and not having too much protraction forward with the pull of gravity. And then she's going to get some just protraction, retraction of the shoulders themselves. Shoulder blades kind of seem to poke out, so to speak, in the retraction. She's trying to get as much motion as she can only from the scapula region and the shoulders, not from the head, but she's having a hard time keeping that chin tucked down. And then we're just taking in some shoulder flexion. Once again, trying to keep from shifting the weight. Usually a little easier for most people to do this than it is with the hips, because the center of gravity and center of mass is so much closer to the midline than it is with the much lighter portion of the upper body. But nevertheless, she's having a great deal of hard time with that shoulder flexion because she's so tight up in the upper neck region, trapezius muscles. And you can once again see, once we bring the two motions together, the hip and knee extension with the shoulder flexion, she's shifting her weight a fair amount. Her feet and knees are a little close together, which also affects her a little bit. And she's getting a lot of compensation in the lumbar spine as she extends. And so the gluteus maximus is not activating like it should. And because of the tight upper traps, more than likely in her case, and all around that shoulder joint, she's having a difficult time getting sufficient flexion of the shoulder. She's not even really able to get it to parallel to the ground without some sort of compensation. To her credit, she's keeping control rather than trying to overemphasize the movement to the detriment of the muscles we're really trying to activate through this motion. And again, she's dorsiflexing at the foot to try and reinforce that same action. Lateral walking is a great exercise, but you really have to make sure they can already stabilize in space with some of the other basic warm-ups prior to this. Getting abduction and adduction. The second step should not be too close to the first step. Maintain tension on the band in both directions. Trying to drag the foot, which she's doing quite a bit of, and trying to raise the hip. If you drag the foot, the tension's not going to be there. And if you raise the hip, you're actually once again getting quadratus lumborum activity, not the gluteus medius like we're trying to hit, and the adductors like we want to aim to activate as well. The knees should once again stay right over the second and third toes while doing this exercise as much as possible. Just going to take that into a forward walk, still trying to abduct the hips, keeping the feet as wide apart as possible. Whether it's a lateral walk or the forward walk, the feet should land flat on the ground, not toward the front of her foot, which she'll do in a short bit here a little bit. She's doing a little too much with landing on the ball of her foot, as we're used to doing. She'll have a harder time with the backward walking. Should progress in this order too. Lateral walking before forward, forward before backward. Keep the weight slightly forward, leaning forward the whole time. Wide stance. Feet must land flat. Keep the knees tracking in line. Once the assessments have been performed and you have a better idea about what the client's capable of, what their goals are, and how you're going to meet both their goals and then secondarily their needs, make sure you've actually provided a good warm-up, which means at least 5 to 10 minutes, maybe longer. The warm-up may comprise the bulk of the workout, the first few sessions. And here's a few functional exercises that are going to follow upon that warm-up, starting with the core musculature and a cobra exercise, once again here, where the elbows are extended. The thumb should be externally rotated, so that actually you're getting a supination at the wrist, also external rotation at the shoulder. The shoulder blades are retracted, Actually reaching for the feet as you raise yourself up to make sure you get, again, proper scapular motion as well as external rotation of the shoulder to reinforce proper movement patterns when we're sitting, like so many people tend to reinforce the wrong direction. And she's going to show Superman again here very briefly, with the legs coming off the ground a little bit here. She's actually doing a better job now, probably because she's been at this for a while. Your clients, after doing this a few times, may actually learn the patterns and be able to compensate or get warmed up enough where you can't tell their compensations as much, or simply learning to activate the muscles after a few repetitions. So we're going to draw the abs in tight before any movement occurs, and she's not getting a lot of scapular movement there. She's so tight through that shoulder region. Trying to raise the arms up off the ground at all is rather difficult for her. She's keeping the chin tucked in pretty well, but she's also trying to be very controlled and not overcompensate. You want to make sure that the transverse abdominis is active in this exercise and all exercises, because once again the spine and the stabilization of the spine is the most crucial aspect to any exercise, regardless of the goal of the exercise. And she's going to get herself situated here for a different look at the cobra, so you can see her more from the front view, be roughly speaking her anterior. And again, she wants to bring that head up. Most of your clients will want to. Most trainers forget to watch the head. And we're going to remind her here to depress her shoulders a little bit, because those shoulders are elevating because those upper traps that are tight levator scapula, those muscles that tend to over-exaggerate tightness in the lateral part of the cervical spine, as well as all throughout that shoulder region. And she continues to have to kind of loosen up a little bit between these exercises because they can be pretty difficult for her getting good mobility. And then she's holding a Superman here once again, trying to extend the fingers as well. And when you tend to tighten up the fingers, the rest of the body tends to follow. Just trying to actually loosen up the fingers and get good extension through them as well, not having them flexed or relaxed so much so that the palms tend to kind of fall down closer to the ground, kind of reinforces that extension throughout the whole region from the elbow to the wrist and the fingers. Then we'll return to a supine position, back on her back here once again, into a bridge. Bridge is one of the most important exercises that either is done improperly or avoided, because it seems like such a simple thing, but it is so imperative to make sure this exercise can be controlled. She's actually taking her hand and literally hitting herself in the rear here, because I told her to do, and you should tell your clients to do the same, to make sure the gluteus maximus is activating like it should. When you kind of give it a physical bump with your hand or knock it a little bit, it tends to kind of react against that and contract, and that's what we want. You don't want to get too much lumbar extension. You want to make sure the transverse abdominis is drawn in. It's actually flexing her toes a little bit and dorsiflexing. Keeping those knees in line with the hips. Dorsiflexion at the ankles if you like. But the most important thing is the abs drawing tight, glutes squeezed tight. The exercise should not be felt in the low back or in the hamstrings. Then we're going to move her into a side lying position. From here, she's going to perform a lateral bridge or lateral plank. And this exercise, again, because it's drawing her hips down toward the ground, is going to require a great deal of recruitment, not only of the transverse abdominis, but the obliques as well as the gluteus maximus and gluteus medius, to keep those hips stable and keep them from rotating too much. Most people will have that right shoulder, in this case, the upward shoulder, rotate too far forward. They won't be able to retract appropriately the scapula, getting the shoulders back. She's really doing a pretty darn good job at this exercise here. And a good old squat. Some people may tell you that they were told not to squat by the physical therapist or their doctor or sports medicine specialist. Whoever it was that may have told them this, there probably is a good reason for it, and there's probably a good reason to be careful about certain movements, but you're probably going to want to double check on that, because it's very likely they just want modifications, not loading squats. But everybody should be able to sit down and stand up of their own cognition without having to have some stable support, unless they have some other extenuating circumstance beyond some minor knee pain. I want to make sure you check with the therapist on that as well. But her arms folded in front of her is the basic first level of a squat. Sticking the hips out behind a little bit. The first motion should really be almost exaggerating, sticking the rear nut behind you, withdrawing the abs in a little bit. You don't get too much of an anterior pelvic tilt. Then descending will help getting a lot more of the emphasis of the weight backward, keeping the heels on the ground. Heels should not come off the ground, or again, it's an indicator of tightness in the calves. If she can't get good depth, it's oftentimes tightness in the calves. She's getting a fair amount of extra rotation there at the shoulder joint as well, or at the ankle joint, which also may be indicative of tightness at the hip, because when the hip rotates, so does the knee, and so does the ankle. Her depth is getting a little better as she gets warmed up, but you want to make sure someone can perform active range of motion with a body weight squat before you start to load, or add, in this case, a medicine ball. So we're going to do a little medicine ball activity here, where she's getting shoulder flexion coming up and over her head. So she's going to involve the stabilizers of her spine, as well as the glenohumeral joint, shoulder joint, along with the squat. So kind of progressing a little bit further beyond just the regular body weight squat. It takes a little more concentration to keep herself level and upright. Draw the abdominal muscles in tight. The difference between bracing, again, is all the muscles of the core area are active statically, and just the transverse abdominis drawing in maneuver is only the deep tissue abdominal musculature and spinal stabilizers. And we're going to take from that shoulder flexion movement into a crossing pattern. In this case, she's performing a standing squat, a squatting motion with a standing wood chop and or lift. Medicine ball, it's kind of an all-in-one exercise because gravity is pulling it down the whole way, so it's really more of only a lift exercise than performing with medicine ball, because gravity is always acting against you when you're performing anything with free weights or a medicine ball. Everything must line up with gravity if you want to activate muscles appropriately. Otherwise, you want to make sure you're very aware of what the goal is, and you choose to go any crossing patterns with a medicine ball or a dumbbell. The load needs to be very light. In this case, I believe it's a 1 kilogram medicine ball, so it's pretty light. So you can really focus on the motion. She, of course, again, displays that anterior pelvic tilt a little bit and has a hard time with that shoulder flexion. You start to see some recurring patterns, so we'll start to be able to identify them well enough where you actually can design the program around that and choose exercises that don't allow for those compensations until the muscles that need to be recruited. In this case, making sure she can draw in the transverse abdominis, get the glutes active, the external rotators of the shoulder, and the scapular adductors and depressors are all a little bit weak. This is a very complex exercise. The load is light, the tempo is very easy, but the exercise involves so many muscles, like most of these functional exercises do, because the idea of a functional exercise is, once again, to incorporate muscles of the upper body, lower body, and the core musculature of the lumbo-pelvic hip complex. Just going to take that into a kneeling position, which actually should be the previous progression to the standing version, and perform that same chopping, or in this case, lifting exercise, always bringing the ball up or the weight up toward the forward leg. It's going to provide a little bit more stability. It's going to be a little more awkward trying to perform that movement from the opposite angle, coming from the outside of the forward leg. She's going to get a little bit too much extension at lumbar spine, reminding her to draw in there, trying to activate the gluteus maximus muscles and deep tissue abdominal stabilizers and spinal stabilizers. And you can see she had a difficult time even getting up how to actually lean forward in that leg a little bit. The anterior pelvic tilt has a great deal to do with that, the ability to extend at the hip to actually stand up without utilizing hip flexors or some external support. We really want to have this action be about a 45-degree angle. She's a little sharp with that angle as far as upright. It needs to be more gradual out to the side, and she'll start to get that a little more if she does it here. Try and keep both hands parallel to the ground. She's actually getting some rotation here, a little too much so. I keep the hands both on equal sides of the ball, parallel to the ground as much as possible. Trying to keep both arms extended. It's a real strong tendency to get that right elbow in this case, where she's pulling up toward, flexing too much. Want to keep it extended. And we'll start to see a lot more compensations, or hopefully not much at all, at the spine and the hips. Very controlled motion. Just going to take that into a squat with rotation. Now again, a bodyweight squat's hard enough for most people to get good range of motion. The mobility and the stability has to be there before performing this movement. And actually, she's actually not quite ready, as you can see, and I'm going to tell her right here to get more abduction at her hips because her knees are coming a little bit. She's already got a little bit better there. But she still wants to shift. Particularly that right hip's going to kick out when she moves to the left. The left hip's going to kick out a little bit when she moves to the right as well. That's very much a sign of inability to activate the rotators of the hip and the spine, meaning the obliques and the glutes effectively, because she doesn't first have that stability from deep tissue stabilizers of the spine and the deep tissue abdominal musculature. And she's going to take that into a lunge with the same motion, which actually is going to be a little easier because she's got the stability of the back leg, a little bit of wider stance, so her center of mass is a little bit more situated in a more stable place. But you can see that right hip really want to kick out. You can see how a lot of people feel that just because they can do it, they should do it. She's performing the movement okay, but she's getting a lot of compensations. So if she actually continues this exercise without getting those muscles active that she needs to, she's going to keep those same compensations and create further possibility of injury or certainly dysfunction, and no one really knows for sure what that's going to mean over time, but certainly to detract from her performance, her capability to gain aesthetic goals, whatever that may be. If she can't move properly, kind of a hard time training the muscles like you want to train them, so consequently any goal is going to be hindered by that. We're going to show that same exercise with the cable. The cable is actually a little more complicated as far as keeping the control, and you can load that up a fair amount. You got to be very careful when you load. It's okay to get a little spinal flexion when the chop comes down and across and in. I'm putting a little Airex pad below her knees, so a little support, so it's not quite so abrasive to her knee when kneeling on the ground. I'm going to quickly show that same cable rotation or chop, in this case from a standing position as well. You can add a little squat in if they're ready for it, but otherwise try and keep the knees relatively stable and still until the proper stability is shown there. That word stability is going to keep coming up over and over again because stability has to occur before mobility. If they can't stabilize, they're not going to mobilize very well. They're going to compensate. Those compensations are going to lead to other problems. Making sure that abdominal muscles draw in tight before any movement occurs. Smooth motion should occur more from the abdominal musculature and the rotation of the spine than from the arms. The arms are going to help move, but they really want to be there more as something holding on to the weight as opposed to being primary movers, in this case now a rotational movement or adduction, abduction movement for the shoulders. You can choose to either come all the way back and across or just halfway across to activate the obliques differently. She has a real strong tendency to want to keep that knee right above that ankle joint, and I keep reminding her of that. Part of that's a learned pattern, but also it's keeping her from getting a sufficient dorsiflexion. So here again, she's coming all the way back and across, which is okay, but she's going to lose attention on the internal and external oblique, and it's going to switch to the other internal and external oblique as she rotates all the way across. She just keeps going to one side. In this case, her left internal oblique and her right external oblique are going to be active. And it's going to switch if she rotates all the way to the other side. So it just depends on the goal. She's going to perform that now, the last portion, the lifting portion with the cables, which really ends up being the most difficult of the three. The standard rotation tends to be the easiest, followed by the chop, and the most difficult, mostly because of loading, and it feels a heck of a lot heavier, is actually lifting as opposed to chopping while rotating. So here I decided to give her a variation. Actually, can reach a little longer. A gentleman by the name of Ray Cook came up with this one. Extending her arms quite a bit wider apart here, and coming up and across her body. It's actually going to help get a little more stabilization of the scapular musculature and the glenohumeral joint again for the shoulder, but she has to really watch she doesn't get too much of a turn with her head and neck. Again, it may compensate with the hip rotating as well. It has to be very controlled. The idea being that the time she rotates up and away, that left arm should be directly behind the right arm if possible, but she has a great deal of difficulty just getting into that flexion movement from the shoulder, let alone try to add a weight and a lot of other movements along with it. Make sure they're ready for that progression rather than just trying to progress them onto something that looks cool or that seems like something different to do. Progressing for variety's sake in itself is not a good rationale. And the standing version is going to be easier for people to do because all of a sudden the legs are there to stabilize. You're going to get a lot more ease of movement standing than kneeling or sitting for the abdominal musculature because the legs are all of a sudden helping a little bit, which again is probably a negative if dysfunction is occurring, because then we're not going to be able to see as much, and her dysfunctions and compensations, whatever they are going to continue to be prominent if we don't take the time to do it while kneeling or sitting. Lastly, to show a pull-down movement. Pull-down is a very popular exercise. The forearms must remain parallel. The wide grip, close grip, internal grip, all those crazy grip bars that we have really don't make a whole lot of sense. It's based a lot more on feel. You can use them, but make sure you have a solid rationale for why. You want to go as low as possible while keeping the forearms parallel to each other, not getting too much internal rotation at the shoulder, and having good control with movement real close to the body. Those are just a few of the progressions for the functional training program. Those are the beginning progressions for the most part. The other progressions will be included there in your manual. Progress as you see fit, using your professional judgment and your professional expertise. Make sure you have a solid rationale for progression. Make sure you take the time to assess, warm up, and progress to exercises that suit the client's goals, bend their needs, and take the time to understand what your client wants and make sure they understand that their job does not end when they leave you. Good luck and the best of success to you.